In our Health Alert today, 2 studies just released on autism. Liz has details in our Health Alert today. Liz?
All right, and good afternoon to all of you. The first study released today confirms previous reports, which says there is no link between the MMR vaccine and a diagnosis of autism in children. Researchers in the Journal of the American Medical Association, which supplied this video, looked at 95,000 children and followed them from birth to 5 years old. Now, they were interested in those who had an older sibling with autism, which does put a younger child at higher risk. The results found no evidence of an association between the MMR vaccine and autism. Now, the second study released today found kids with autism could be helped by focusing on parents. Most treatments focus on the kids, but this new study teaching and training parents helps them interact with children with autism. It also can help manage symptoms, according to researchers at Ohio State. They supplied this video and say when experts were used to train parents, after 24 weeks, 7 out of 10 children showed dramatic improvements in behavior. This was the same response rate as most effective drugs on the market. The parents were trained to identify triggers that could lead to problems and how to use visual aids to better communicate. They also were taught which behaviors to ignore and which they should try and change. Now, what's more in all this is that the improvements the kids made seem to last. 6 months after the study, 80% of the kids who responded in a positive way still showed those improvements. The average patient in the study was 4.5 years old, which is really important because many families say they would like to try behavioral therapy at an earlier age before exposing children to medications and, of course, the side effects they carry. This study also published in the latest edition of the Journal of the American Medical Association. Interesting stuff there.
You get, but interesting, I mean, this field right now is like by the minute.
You know, it is, and people always say it's, you know, what you tell us yesterday isn't the same as today. It's a science. Yeah. But what's really important is we're finding out what doesn't cause autism. Right. We're looking at things now like gestational diabetes and alcohol use in pregnancy, and we should be hearing more about what we can do to prevent, and more importantly, what you can do if you have a child, which I think is really important. Really is.
Liz, thanks. Appreciate it.